Polyarthritis nodosa (PAN) is an systemic vasculitis. Systems involve, look at this, urinary system, cardiovascular, a digestive, gastrointestinal system involves, look at this, medium sized arteries, inflammations, then signs and symptoms. Angiography, look at this. Angiography findings, kidney vasculitis, medium sized arteries. Then nervous system, brain, MRI findings, and MRI kidney. These organs affected by vasculitis, look at this. A detail going on. Introduction. Polyarthritis nodosa is a rare systemic necrotizing vasculitis that primarily affect medium sized arteries, leading to inflammation and damage to various organs. It is associated with significant morbidity and can be life-threatening if left untreated. A definition: polyarthritis nodosa is a rare autoimmune disease that causes inflammation and damage to small and medium-sized arteries, leading to organ dysfunction, especially in the skin, kidneys, nerves, and gastrointestinal system. It is often associated with hepatitis B infection and presents with symptoms like fever, weight loss, muscle pain, and high blood pressure. Etymology. The term polyarthritis nodosa comes from Greek and Latin roots. Poly, Greek many. Arthritis, Latin and Greek inflammation of the arteries. And nodosa, Latin, knoti or nodular, referring to the diseases. Characteristic arterial inflammation with nodular lesions. The name describes the condition's hallmark feature: widespread inflammation and damage to medium-sized arteries, forming nodular swellings. Types 1. Classical PAN affects multiple organ systems including the kidneys, skin, nervous system, and gastrointestinal tract. 2. Hepatitis B associated PAN linked to chronic hepatitis B infection. 3. Cutaneous PAN limited to the skin causing painful nodules, lived reticularis, and ulcerations. Causes. The exact cause of PAN remains unknown, but it is believed to be related to immune system dysfunction. Some potential causes include 1. Autoimmune reactions, 2. Hepatitis B and C infections, 3. Genetic predisposition, 4. Environmental factors, 5. Drug reactions. Risk factors 1. Chronic hepatitis B or C infection, 2. Autoimmune disorders, 3. Male gender, more common in men and women, 4. Middle aged individuals, typically 40 to 60 years old, 5. Exposure to certain drugs or toxins. Complications 1. Renal failure due to ischemic nephropathy, 2. Hypertension, 3. Stroke or transient ischemic attacks, 4. Peripheral neuropathy, 5. Gastrointestinal perforation or hemorrhage, 6. Myocardial infarction, 7. Skin ulcers and gangrene. Pathophysiology. PAN is characterized by segmental transmural inflammation or medium sized arteries. This leads to fibrinoid necrosis, aneurysm formation, and subsequent vessel occlusion. The ischemic damage causes infraction in affected organs. Unlike some other vasculitides, PN does not involve granulomas or ANCA associated mechanisms. Pathophysiology of polyarthritis nodosa PAN, step by step process. 1. Immune complex deposition and inflammation initiation. An unknown trigger, possibly infections like hepatitis B or an autoimmune reaction, causes immune system activation. Immune complexes, antigen antibody complexes, deposits in the walls of medium sized arteries. 2. Endothelial damage and inflammatory response. The immune complexes activate the complement system, leading to inflammation. Neutrophils and monocytes infiltrate the vessel walls, releasing cytokines, example TNF, alpha, IL-1. 3. Fibrinoid necrosis, vessel wall weakening. The ongoing inflammation leading to fibrinoid necrosis, destruction of the arterial wall with fibrin deposition. This weakens the vessel walls, increasing susceptibility to aneurysm formation. 4. Thrombosis and ischemia. As the damaged vessels heal, fibrosis and thrombosis, blood clot formation occur, leading to narrowing or occlusion of the arteries. Reduced blood supply ischemia causes tissue and organ damage, commonly affecting the kidneys, skin, nerves, and gastrointestinal system. 5. Multi-organ dysfunction and clinical manifestations. Ischemia leads to symptoms such as hypertension, renal involvement, skin ulcers or purpura. Mononucleosis, multiplex, which means nerve damage, abdominal pain, GI involvement, and muscle joint pain. 6. Chronic progression or replace. The disease progresses in the relapsing, remitting, or chronic manner with ongoing cycles of inflammation. Necrosis and healing. Without treatment, widespread organ damage can occur. This step-by-step process explains how PAN causes vascular and systemic complications. Signs and symptoms. 1. General symptoms: fever, weight loss, fatigue, malaise. 2. Skin, livido, reticulitis, nodules, purpura, ulcers. 3. Renal, hypertension, renal insufficiency. 4. Neurological, mononucleosis, multiplex, peripheral neuropathy. 5. Musculoskeletal, myalgias, arthralgias. 6. Gastrointestinal, abdominal pain, nausea, vomiting, bowel infraction. 7. Cardiovascular, myocarditis, heart failure, coronary artery involvement. Diagnosis. A. Laboratory test. 1. Elevated erythrocyte sedimentation rate, ESR, and C. Reactive protein, CRP. 2. Anemia and leukocytosis. 3. Elevated serum creatine if kidneys are involved. 4. Negative ANCA test. 5. Hepatitis B and C serology. B. Imaging studies. 1. Angiography showing microaneurysms and stenotic lesions in medium-sized arteries. 2. CT or MRI can reveal organ infractions. C. Tissue biopsy confirm the presence of necrotizing vasculitis in affected tissues. Nursing diagnosis. 1. Risk for impaired tissue perfusion related to vascular inflammation. 2. Acute pain related to ischemic tissue damage. 3. Risk for infection related to immunosuppressive therapy. 4. Impaired skin integrity related to cutaneous manifestations. 5. Activity intolerance related to systemic inflammation and fatigue. Disease management. First, medical management. 1. Corticosteroids. First line treatment to reduce inflammation. 2. Immunosuppressants used in severe cases. 3. Antiviral therapy for hepatitis B associated PAN. 4. Antihypertensive medications to manage hypertension. 5. Pain management, NSAIDs, opioids if necessary. 6. Plasma psoriasis. In certain cases of severe PAN, nursing management. 1. Monitor vital signs, especially blood pressure and heart rate. 2. Assess for signs of organ ischemia, renal function, neurological deficits, skin changes. 3. Administer prescribed medications and monitor for side effects. 4. Provide pain management interventions. 5. Educate patients about medication adherence and potential side effects. 6. Encourage rest and gradual activity as tolerated. 7. Prevent infections by maintaining hygiene and monitoring immunosuppressed patients. Treatment options. 1. Pharmacological, corticosteroids, immunosuppressants, pain relievers. 2. Surgical, vascular bypass surgery, amputation for severe ischemia. 3. Lifestyle modifications, healthy diet, smoking cessation, regular exercise. 4. Plasma psoriasis. In cases with associated hepatitis B. 5. Supportive care, pain management, physical therapy and psychological support. Psychosocial medicine. 1. Patient education, healing patients, understand their conditions and treatment plan. 2. Counseling and support groups to address emotional and mental health concerns. 3. Stress management techniques, yoga, meditation, deep breathing exercises. 4. Family involvement, educating and involving family members in care. 5. Financial and social support, connecting patients with resources for medication and healthcare assistance. Disease prevention. 1. Early detection and treatment of hepatitis B and C. 2. Routine health checkups for at-risk individuals. 3. Avoiding known triggers such as certain medications or toxins. 4. Maintaining a healthy lifestyle to reduce the risk of hypertension and vascular diseases. In conclusion, polyarteritis nodosa is a rare but serious systemic vasculitis that requires prompt diagnosis and treatment to prevent complications. While the exact cause remains unclear, immune system dysregulation and infection like hepatitis B play a crucial role. Management involves corticosteroids, immunosuppressants, and supportive care to control symptoms and prevent organ damage. With timely intervention, the prognosis can be significantly improved. Thank you. Have a nice day.